Welcome to the Continued Spotlight on Education presented by Neosho County Community College. I'm your host, Huntyr Schwegman, and I'd like to thank you for tuning in today as we put a spotlight on the news, upcoming events, and academic programs at NCCC. And in today's episode, we will be highlighting the Healthcare Coding and Health Information Technology programs here at Neosho County during Health Information Professionals Week celebrated April 21st through April 25th. Joining us on today's episode will be once again Jen Brown, the Program Director for both the Healthcare Coding and Health Information Technology program, as well as the phlebotomy program, which we've previously highlighted. So Jen, we've spoken previously about some of your background, but just to remind people a little bit, how long have you worked at Neosho County, and what is your background within the medical field?
So I've been back at Neosho County Community College, entering my 12th year. Since 1991, my medical background has grown from traditional direct patient care roles to the behind-the-scenes work in health information management.
Before we get too far into the specifics of these two programs that we're spotlighting today, can you maybe describe to us what each of these programs kind of entails? Maybe what are the similarities, the differences? What are some of the things that these two programs teach students?
Some professionals choose to accomplish their coding credential and focus on reviewing the medical record documentation and assigning diagnosis and procedure codes. And others may concentrate on areas of fraud and abuse, software analysis with electronic health records, or various healthcare leadership roles. The health information management field itself is just a field that bridges the business, scientific, and legal sectors of healthcare. So it kind of intertwines with information technology and that revenue piece that the medical coders are getting. But given the diversity of the field, it's really challenging to pinpoint the exact responsibilities a graduate might find themselves undertaking.
For a student who's potentially interested in joining either one of these programs, are there any prerequisites that they need to be aware of before joining the program? Like, do they need to be a certain age? Are there certain classes they need to take? Any work experience they need to have beforehand?
There are no specific prerequisites to get started. Our students come from diverse backgrounds, so we tailor our approach and customize schedules to meet the individual needs, and that can be a variety of work experience, lack thereof, and really we have no age limits at this time.
So you mentioned a lot of students who come from diverse backgrounds. Does that include like non-traditional students, like working adults? Are there options for people to take classes online or in hybrid formats, or maybe even in the evening?
Our programs from inception were developed to be online for our working adults. So there's an online option for all of the courses that are required for these programs.
So let's talk about some of those classes then. So what kind of classes are included in the program? Maybe what kind of skills are students learning throughout the program path?
As with most healthcare programs, our students do need an understanding of medical terminology, anatomy and physiology, and pathopharmacology for a good healthcare foundation. But as they progress through the program, there is coursework over learning not just the ICD-10 and CPT coding systems if they were, going to end with the coding certificate. We also look at how this impacts reimbursement and ultimately revenue for our providers and the facilities.
And let's take a look now at each program kind of specifically. For health information technology, what kind of certifications or degrees are students looking to complete, and about how long does it take the average student to complete this program?
Students from our Health Information Technology program generally stay with us somewhere around 4 to 6 semesters. They are eligible for the same opportunities and certifications as our coding certificate. However, they are also eligible for the National Registered Health Information Technician exam through the AHIMA.
You mentioned that the Health Information Technology program does include some of the certifications that you can earn in the coding side of things. So tell us a little bit more about some of those certifications.
So our coding certificate program allows students to be eligible for a coding exam of their choice, and that would be a national certification. And they also complete a national billing exam while they are in the program.
Next up, I want to hear your little elevator pitch on what you think makes the programs here at Neosho County so special, specifically these two, and why would you recommend to potential students that they take these courses over maybe going directly into the workforce?
I believe it's beneficial to address issues proactively rather than just managing them at work. That said, we value the diverse experiences our students bring to the classroom, whether they're newcomers to the field or they have prior experience in health information or other areas. We've had nurses and currently a physical therapy assistant and others who have transitioned their previous experience into coding or HIM. What sets us apart is our commitment to knowing our students personally and our involvement in both the state and national professional associations.
Enrollment for summer and fall classes is now open at Neosho County Community College. Choose from over 40 programs like aircraft sheet metal assembly, nursing, automotive technology, occupational therapy assistant, surgical technology, welding, and many more. Whether you're looking to earn an associate's degree or break into a new career field with a certificate, NCCC offers something for everyone. Email advising@neosho.edu to start your academic journey at Neosho County Community College today. Do these programs offer opportunities for students to maybe take on some internships while they're in school? Or do you guys have any kind of partnerships with local hospitals, clinics, or physicians' offices to secure job placement for graduates?
So student placements for internship can really occur in a variety of settings, including, yes, our local hospitals and clinics, but also our remote vendors, because our students can really be anywhere. And we are thrilled about the upcoming changes to our curriculum as we transition to a competency-based education model. This shift is going to distinguish our students by providing some opportunities to collaborate with industry professionals and receive some additional feedback from experts in the field. Our program was one of fewer than 40 in the nation accepted by our accreditors to become part of the first cohort of demonstration programs, granting us early access to implement transitions in the new curriculum model, and it will benefit our students greatly. Through this, one of our partnerships that we've done for interdepartmental collaboration is with Melissa Dugan and her paralegal students. So we're really excited about our students having the opportunity to work with other soon-to-be professionals in the field and a sitting judge.
Speaking of graduation, after students complete either of these programs, what kind of job roles or settings do students typically end up in? Like, can you share any success stories of program graduates or maybe a day in the life of one of your graduates?
We have graduates that really have all kinds of interests, from landing that first job to moving up in their current position. I actually have a few examples in just the last couple of weeks where we've had a student that has been working at one of our local rural hospitals, and then she wanted to obtain her RHIT credential to increase her earning potential. She graduated in December, and she has already secured a promotion to their corporate office, and she's working as a data integrity specialist. Another student moved into a bill review analyst position for a company in Overland Park, and she's auditing medical bills, reviewing those state fee schedules and customer guidelines and the provider discounts and all those things that come with sending out a bill to be paid. While a pay increase is also great, both of them are able to work remotely. And I would add that one reached out and was looking to recruit other recent graduates, which demonstrates that we have really great professionals who graduate from our program.
We're sitting down to highlight the Health Information Technology and Healthcare Coding programs during Health Information Professionals Week this week. For you guys as health information professionals, what kind of ways are you guys going to celebrate this week? And how important is it to have a week like this to celebrate the work that goes on in your field?
Well, this really provides us an opportunity to educate people about what we do in health information. As I noted previously that I spent spring break in Washington, D.C. on Hill Day, and so some of the things that we bring to the profession is advocating for our patients, and that's really important. One of the acts is the Match It Act of 2025. So we'll be highlighting that during HIP Week. And that was to enhance patient matching and addressing issues stemming from patient misidentification, such as compromised care and financial burdens and privacy risks and compliance challenges, which includes health IT certification requirements, all things that our students could be involved in post-graduation. And the other one is advancing non-clinical artificial intelligence in healthcare, the Act of 2025, which is going to look at how we evaluate the risks, benefits, and policy options related to AI in healthcare and how that affects HIPAA. So this could involve having those work skill gaps addressed. And we know that we want to harness the power of HIM to become advocates for our patients as professionals in the field, especially since there's no current regulations around this. And our students are going to get the ability to know how to bridge those gaps in the field.
Well, Jen, I want to thank you again so much for joining me today and spending some of this beautiful Monday afternoon talking about the health information technology and healthcare coding programs here during Health Information Professionals Week.
I appreciate your time today, Hunter. We look forward to recognizing all of our health information professionals in the field, as well as these up-and-coming graduates. And so anyone is interested in either the medical coding or the health information technology program, you're welcome to reach out at jbrown@neosho.edu.
Make sure to follow Neosho County Community College on all your favorite social media platforms to follow along as we highlight these two special programs during Health Information Professionals Week. Moving out of the world of science and healthcare, another thing we'd like to highlight this week is the ongoing student art show happening on the Chanute campus in Sanders Hall. Stop by from 8 a.m. to 5 p.m. this week to check out some of the great student artwork created throughout the 2024-25 academic school year. If you're listening to this episode on Wednesday, April 23rd, stop by at Sanders Hall tonight at 7 p.m. for the student art show reception. Meet with the artists and have some refreshments, as well as speak with instructors about upcoming art classes in both the regular art department and the lifetime learning. If the student art show isn't enough to scratch your creative itch, join us this Sunday at 4 p.m. for the band and choir concert as the NCCC music department and the Chanute area community chorus presents That 70s Show, and a show entirely dedicated to music from the 1970s. Entry to the concert is free, and make sure you enter the doors of Sanders Hall next to the auditorium. That concludes this week's episode of the Continued Spotlight on Education presented by Neosho County Community College. My name is Huntyr Schwegman, and I'd like to thank you all again for tuning in today. Don't forget to come back next week as we highlight another amazing aspect of Neosho County Community College, and visit neosho.edu for more information and to enroll at NCCC. Go Show!